Wondering if your test is covered by your insurance? You're not alone, let's break it down. Today we're diving into a topic that sits at the intersection of diagnostics, oncology, and healthcare access, insurance reimbursement for companion diagnostics. Let's go through some terms so that you could better understand the framework. First up, companion diagnostics, or CDx. These are special tests that help identify which patients are most likely to benefit from a specific therapy. Want to dive deeper? Check out the video linked in the description. For patients with advanced cancer, Medicare covers FDA-approved CDx tests that use next-generation sequencing, as long as they're used according to the label. This is part of a national coverage determination called NCD 90.2. Outside of national Medicare rules, there's something called MolDX. These are local coverage decisions managed by groups like Palmetto and Meridian. Coverage depends on specific regional policies. When it comes to private insurance, coverage varies by plan. So it's always a good idea to check with your provider. PD-L1 testing, like the one from Agilent, is billed using surgical pathology and immunohistochemistry codes. It's generally covered when medically necessary, but keep in mind, it's handled under pathology policies, not the CDx Medicare rules. Foundation Medicine leads the field with FoundationOne CDx and FoundationOne Liquid CDx. Both are FDA approved and enjoy national Medicare coverage under NCD 90.2. That means if the test is used according to its FDA label, Medicare pays for it. Commercial insurers also widely cover these tests. Guardant 360 CDx is another FDA-approved liquid biopsy. It's also covered under NCD 90.2 and reinforced by MolDX local coverage decisions, especially for plasma-based profiling. This makes it accessible for both Medicare and many private payers. Thermo Fisher's Oncomine DX Target test is a tissue-based panel, mainly for lung cancer biomarkers. Since it's FDA approved, it also falls under NCD 90.2, ensuring Medicare coverage when used per label. Illumina offers TruSight Oncology Comprehensive, TSO-Com. It's eligible for Medicare reimbursement under NCD 90.2 when used as an FDA-approved CDx, with growing commercial coverage through major insurers. Tempus has the XT CDx panel, which recently received MolDX coverage across solid tumors and myeloid malignancies. This is a big step because it confirms Medicare reimbursement through MolDX, alongside expanding commercial coverage. Myriad brings two important products, myChoice CDx, used in ovarian cancer to measure homologous recombination deficiency, and BRACAnalysis CDx, a germline BRCA test. Both are FDA approved and covered by Medicare under NCD 90.2 for labeled uses. They are critical in guiding PRP inhibitor therapy. Natera Signatera is slightly different. It's not a therapy selection CDx, but rather a minimal residual disease, or MRD, test. Signatera has Medicare MolDX coverage for colorectal, breast, bladder, ovarian, lung cancers, and even for monitoring immunotherapy response across cancers. Coverage is indication-specific, but it's growing rapidly. Agilent's PD-L1 IHC22C3 pharmDx is a classic IHC-based CDx. Instead of NGS coverage rules, it's reimbursed under standard pathology policies when medically necessary for the FDA-approved indications, such as PD-L1 testing in lung cancer and other tumors. So here's the big picture: if it's an FDA-approved NGS-based CDx, like FoundationOne, Guardant 360, Oncomine, Illumina's TSO, Tempus XT, or Myriad CDx assays, Medicare generally covers it under NCD 90.2. For MRD tests like Signatera, MolDX LCDs provide defined coverage by cancer type. And for IHC-based CDx like PD-L1, coverage follows pathology policies. Thanks for watching. If you found this breakdown helpful, don't forget to like, share, and subscribe for more insights on diagnostics, oncology, and the business of precision medicine.